Hello, I'm Deborah Garlick from Henpicked Menopause in the Workplace, and thank you for joining us today. The subject of today's session is menopause and your pelvic floor. Now, this has proved to be a very, very popular subject, and I can understand why. I know certainly I'll be hanging on Dr. Clare Spencer's every word. And in the background today, we have Sally Leach. So we want to hear from you. Any questions that you've got throughout this time, we'll have plenty of time at the end to ask your questions and get your answers. So I'm delighted to welcome Dr. Clare Spencer from My Menopause Centre. Thank you very much for joining us, Clare.
Oh, thank you for having me.
And first of all, I'm going to ask you to take the mystery out of this and tell us, what is our pelvic floor?
Yes, that's a great question, Deborah. So, in the base of our pelvis, we've got a big sheet of muscle and connective tissue that basically keeps up and keeps in place the pelvic organs. And by pelvic organs, I mean, so going from the front by your tummy to the back by your bottom. So we've got the bladder, we've got the womb or uterus with the cervix just below it. The vagina sits just underneath that. And then the rectum and the anus. And so the band of muscle keeps all of that up and in place.
So this is a band of muscle. We've all got it. And when you say it holds everything in place, that's great when everything's working well, isn't it?
Absolutely.
And everything is absolutely functioning properly. What are the changes that could happen as we age and as we go through menopause?
Yeah, so so there are two parts to that. There's aging and then there's the menopause, which are slightly different mechanisms of action. So what you have to remember is there are estrogen receptors in the pelvic floor muscle and the sort of bands of connective tissue that hold it all in place, sort of glue it to the side of your body. So menopause first, when we lose estrogen, the estrogen receptors in that muscle and the connective tissue don't get plugged, and so it basically becomes weaker. The collagen loses its integrity, so it becomes thinner. The collagen is obviously in the connective tissue, and so really depressingly, things can just start to sag. And then aging separately, so this occurs to men as well, but aging separately results in muscle weakness, in tissue thinning, in changes, so the area is not as vascular, the nerves don't work as well as they used to do. Am I depressing you, Deborah?
A little bit, yes. I'm actually thinking I'm not looking forward to this. And actually it happens earlier than we might think, isn't it? I know we talked before this session today and said, we probably think of some of the things that happen as much later in life. So when could this start to happen?
Yeah, so some people just have a naturally weaker pelvic floor. They're almost born with it. And so more people are prone to weakness. And then if you think about other risk factors for a weaker pelvic floor, it's easy to see why this can start like in our early adult life. So anything that increases the pressure on that muscle, so increases the pressure in your abdomen. So surprise, surprise, pregnancy, carrying a baby, sitting on top of it, childbirth, any condition where they're straining, so chronic constipation, chronic cough, so smoking, carrying extra weight around, again, puts more pressure on that muscle. And so with time, it can weaken. So it can happen from a really young age after having a baby even.
Right, okay. So right, I get that. And from what you described earlier, that wonderful, sounds like one of the most helpful things in our body, that sling that holds everything in place, but actually influences more than you might realize. I mean, some very important things in our life. Sounds like it affects our sex life, our pee and our poo, all potential things that could be affected by a weakened pelvic floor.
Yes, I know. And hence the taboo and the massive embarrassment, and which is why it's so good we're talking about it today. So, yeah, so that muscle also shuts off the exit to your bladder. So as your bladder starts to fall, to get the muscle at the outflow can close round, and so it keeps you continent basically. So a weaker muscle, you're more likely to leak urine with an increase in pressure on the bladder. And same with our bowel as well, that can be affected. And then yes, sex, orgasm, all a lot more intense if you've got really good strong pelvic floor muscle as well.
Okay, so that's some of the symptoms. So how would you know if your pelvic floor was weakening? What might the symptoms be?
Yeah, so they can vary. I think it's a really important point. A lot of people do not have any symptoms. So a lot of women will be walking around with a degree of prolapse and it's not bothering them in the slightest. If the prolapse is affecting your bladder, then the good old leaking, when you cough, sneeze, run, avoid trampolines, very good test of pelvic floor. So bladder, bowels. So some women feel that they need to empty their bowels or may even leak, particularly when they're exercising. That can be due to your poor pelvic floor. Or loss of sensation during sex, just loss of that intense feeling, just feeling a bit numb. So that's the sort of effect of the loss of pelvic floor. And then there's like direct symptoms of things descending. The prolapse, really by definition, is all of those pelvic all of those pelvic organs heading south. So people might feel that they've got a bulge in their vagina, a dragging feeling. Some people can feel something almost coming out of the vagina. Lower back aching, pelvic discomfort and dragging. So they're the sort of direct consequences of everything heading south.
And that is a terribly frightening word to me. When you say prolapse,
yeah,
that is horribly scary. How many of us might get something like, get to this? You mentioned degrees of, and some of us might have a minor prolapse, but it's not really getting in the way of doing anything. Through to those that possibly they may need specialist expert surgery, maybe even.
Yeah, it's really hard to put an exact figure on it because it's so common. We think about 50% of people that we know about, but there may be more with a degree that we don't know about. And also it's the sort of thing that people often don't talk about unless you actually ask them because people are embarrassed. I don't know what you think, but there's still a stigma attached, isn't there, and a shame attached to stress incontinence and those sorts of symptoms.
Well, of course, those symptoms can be very, very embarrassing, can't they? And you don't really want to own up to them, or maybe even it's that you don't want to think you're at that stage in your life when these things are happening to you. We shouldn't be embarrassed or ashamed if this is happening. It's more a matter of what you can do to support yourself, to be at your best, to prepare or to resolve these. Now, I know that we all see lots of these adverts from shouldn't mention brand names. We see lots of adverts for liners, pads, knickers that look like pull-ups and things. But that's not for everyone. So we shouldn't be embarrassed if it's happening. It's more about getting the right help and support. So what can you do about weakened pelvic floors or even prolapse if that's happening for you?
Yeah, so there are different strands. It really depends what your symptoms are. So if we just take it bit by bit. So if it's prolapse that's the issue and it's symptoms of prolapse, like those physical symptoms I described that you might be getting. So first of all, prevention. So pelvic floor exercises, like you are training for the marathon. It really is. It's almost like a lifelong commitment. It's like, you know what it's like. Say you're injured or you're laid up, you can't exercise. Your muscles get weak really quickly. And so if you have got a weaker pelvic floor, number one, it is going to take time to build up the strength again, to strengthen those muscles with pelvic floor exercises. And then you have to maintain it. So prevention, pelvic floor exercises. If you've got any condition that I've just talked about that means that there is prolonged increased pressure on that pelvic floor, so if you're carrying extra weight, obviously try and lose it, because that will help. If you've got chronic constipation, then talking with your doctor about helping that can all be really helpful. So trying to decrease the pressure on the pelvic floor specific to you and your conditions. If it's a physical issue with the prolapse, then as well as physiotherapy, pelvic floor exercises, you can get pessaries. I'm not sure if you've heard of them, that sit inside the vagina that basically hold everything up. So you can get a rubbery ring pessary, you can get other different shapes, and they can be really helpful by taking away the symptoms. They don't solve anything, but in terms of they don't take the prolapse away, but they help keep it up,
Right.
north rather than south.
Right. Okay. So and that would help. That is if you've got it and you need to make the support so that it doesn't get in the way of your life too much.
Yes, exactly. So particularly if you want to, there is surgery obviously as well, which can help. There are various different surgical procedures that can help the physical prolapse. But a pessary, particularly a ring pessary, can be a good temporary thing while you are training up your pelvic floor exercises, while you are maybe waiting for other sorts of treatment.
What about HRT? Does that help at all? Because certainly, things like incontinence, can hormone therapy help with those?
Yeah, so if we're talking about incontinence and so the effect of prolapse, yeah, so there are lots of different strategies. So in terms of HRT, so I told you about the estrogen receptors and the pelvic floor. So you would think, wouldn't you, that then hormone replacement therapy can help keep the pelvic floor stronger, can help keep that connective tissue to be firmer and thicker and stronger as well. There's not a lot of evidence for it, but it sort of makes sense that it should help in prevention before you get to it. HRT can be really helpful as well, in that if you think about what happens to the vagina after the menopause, the vagina can become thin, delicate, dry, loses its elasticity. So if you have got any degree of bulging, any degree of like the cervix and the womb or the vaginal walls bulging in onto the vagina, and your vagina is already really delicate and sensitive, then a vaginal estrogen can be really helpful, not in getting rid of the prolapse, but in just helping the symptoms, of just helping the vagina cope with what's coming at it while you are doing your pelvic floor exercises, seeing a physio, to try and just get everything back into place again. Does that make sense?
Thank you, Dr. Clare. Yes, of course. And so, and are we talking about the systemic HRT, or you mentioned the local HRT?
Yeah, so I'm talking about both. So systemic HRT is what we're talking about when we mean tablets, patches, gels, the HRT that goes into your system. So that can be effective, absolutely. But if people don't want to take HRT, or they've been advised not to, or mainly the only symptom is vaginal, then a vaginal estrogen can be really effective. And probably about a third of women, at least, who take a systemic HRT also do need a vaginal form of estrogen as well. And it's fine to take both.
It's fine to take both. Can I ask you, for those that can't take HRT for whatever reason, or don't want to, can you have the local estrogen on its own?
Yes, the majority of women will be able to. There is a really small percentage of women who will be taking a specific medication to help in the treatment of breast cancer. And HRT, even the vaginal estrogen, we just can't confirm the safety. So then it becomes an individual discussion about the risks and benefits about the vaginal estrogen for you. But, the numbers of those women are quite small, so most people will be able to.
most people will be able to. And how would you talk to your doctor about that? You know, is it something you can get on repeat prescription? Because I know a woman was saying that she had the local estrogen while she was coming up to her a smear test, and it was really good for her, but then she couldn't get it afterwards. And I was a little bit like, oh, that's such a shame. If you found that it was helpful, not just, and you know, local estrogen is not just for smear tests, it can help in so many other ways. Is it something that you can ask for on repeat prescription?
Yes, absolutely. Ask your GP, because there are so few contraindications. There are so few women who really can't use it. So yes, absolutely. I would say if you can take anything from this, please ask your GP for it. The NICE guideline, the National Institute of Clinical Excellence guideline, said that you can take a vaginal estrogen for as long as you need it for. There is no time limit on it. Often people read the leaflet to the vaginal estrogen, and it's got all the risks on that leaflet for swallowing estrogen. So people often get the prescription and then panic and don't use it. But there's no risk of breast cancer, no risk of blood clots from using a vaginal estrogen.
So a very handy tip there then, isn't it? That try and get it on repeat prescription, because what's going through my mind, and yes, you know, if I trained like I was training for the marathon, and I know that there are certain products as well as doing the exercises that you can do at your desk. There you go, I'm doing them now. There's all of those. Does it get better, or are you avoiding it getting worse?
It depends on how bad it is, if I'm completely honest. So absolutely, there is good evidence that pelvic floor exercises, and you've said there's a really good app that you can download, the Squeezy app, for example, endorsed by the NHS. There are gizmos that you can buy that go in the vagina. You can get ones where you try and pop balloons with your pelvic floor on an app. You know, doing all of your pelvic floor exercises will prevent it getting worse. If you've got mild prolapse, they can help reverse it. But if your prolapse is really severe, it can definitely help to a degree. It just may be a bit of a longer slog. And your physio, if you can ask for a referral to a gynae physio, in most areas available through the NHS, they would advise you on what you could expect on your prolapse.
Because we don't all do those sort of exercises. And I guess there is a technique, isn't there? You know, it's not just to sort of sit here and do this in your chair. You need to make sure you're doing them properly.
Yes, no, absolutely. And a lot of people, if you've got a really weak pelvic floor, you might not even be able to feel where and how you're squeezing, because you don't get the feedback from the muscle to begin with. So hence it's really good to see a physio to make sure that you're doing it correctly. But it's that feeling of trying to stop urine or poo coming out. It's that drawing up of that muscle is what you're aiming for, to feel like you're stopping urine coming when you need it to.
Do them and do them right. So I'm just going to see if Sally's getting on, because I can see there are so many questions coming through. But just thinking about this, and I saw a comment come up earlier, we don't talk about it much. We're all embarrassed, but the statistics you quoted earlier, this affects more of us than we might realise. So I wonder what we can do to enable people to feel more confident in saying, this is something that's happening for me right now and I need extra support.
Yeah, I think today is a brilliant example. Don't you think? It's talking about it with your friends. I think it's getting better, talking to your doctor about it, making people aware. You know, I think it's quite good that there's more and more in the media. You know, I know we spoke about the pads and things, so there are adverts coming on the TV, aren't there, sort of highlighting it as an issue. I just think we need to talk about it and admit it more. It's like the sisterhood, isn't it?
Yes, it is.
Grit your teeth, grin and bear it. Yeah.
I think we've all seen those adverts, and I think from our conversation before the session today, we'd probably say, by all means, buy those pads. There's nothing to be embarrassed about. But don't think that's all there is.
Yeah,
there's an awful lot that you can do to help yourself. Because, you know, menopause happens on average around about age 51, and we stand on average a chance to live to well into our 80s. So that the more that we do now, the better we will be for a long time.
Absolutely. You know, just as soon as you become aware of it, if you just educate yourself, find out more. The NHS website's good. We've got information on our website, which is mymenopausecentre.com. You know, just find out about it. Find out how to do your pelvic floor exercises. Yes, and start modifying sort of today, really.
Okay. Your New Year's resolution, I know it's towards the end of January, but your New Year's resolution to get on. And of course, we will link to you, Dr. Clare, so people can find those. And also, I've seen some things coming up about the Squeezy app. But I'd just like to go to and introduce Sally Leach, NPIC Menopause in the Workplace's training director. How are the questions coming through, Sally?
We've got lots of questions, lots of familiar themes coming through. So it's really great. I think a lot of people are thinking and asking similar kind of questions. So the first one was really how often, because there are a few people saying doing them too often, could that cause issues? And I think a few people have had issues where they've done them too much. And just kind of what guidance that we give to people around how often and how people can know they're doing them in the right way.
Yeah, so it is an issue where you can almost over exercise and create too much tension in your pelvic floor, and then that can cause pain. It's awful, isn't it? You just feel like you can't win. The general guidance is 2 or 3 times a day and do sort of 15 reps and work up. You'll read different advice in different places. It will vary according to what your symptoms are, which is why speaking to a physio is quite helpful. But rule of thumb, 2 or 3 times a day. Pilates is a really good way of approaching the pelvic floor and strengthening it, because Pilates is all about strengthening the core, which involves the base of the pelvis. So that's what I would advise. But yes, absolutely, don't overdo it.
Yeah. And people have asked about things like Kegel devices and devices to help you do these exercises. Just any thoughts around that as to whether these are beneficial for people, things people should be wary of?
Yeah, so I think it's so individual. I think if you're a person who likes feedback, and who likes to buy something to try, then they're obviously not going to do any harm as long as you don't overdo it. Then there's, in terms of medical evidence, there's not a lot out there. People just haven't done the studies with them. Some of them are quite expensive. So I would say have a look on the reviews, and just have a think about whether you'll feel comfortable sort of putting something in your vagina and squeezing with it. You know, the more competitive of us will probably enjoy seeing feedback. Others might be discouraged by that. I think it's really up to the individual whether you think it's something that you would use.
Excellent, thank you. And we've got a question around someone's had a pelvic mesh procedure around 10 years ago because they had pelvic floor issues, and they did lots of exercise but felt that was the right way for them. I'm now in 53, perimenopausal since the age of 47, early through breast cancer treatment. Will the mesh help support through menopause? Are there other things they need to be thinking about?
Yes, did you say had breast cancer treatment?
Yeah.
Yes, yeah. Yeah, the meshes are now not being used because a number of people had complications, but they did do a good job for a percentage of women in just basically keeping everything up. Going through the perimenopause, menopause, I would say it's really important to maintain the integrity and health of the vaginal tissue. So if you've been through treatment for breast cancer, it is likely that you will be able to use a vaginal estrogen, but it will need a discussion with your doctor. So if you can use a vaginal estrogen, use a vaginal estrogen. Vaginal moisturizers can be really helpful in preventing dryness. And obviously continuing to do your pelvic floor exercises or Pilates or whatever it is, whichever way it is, to maintain the strength in your pelvic floor as well.
Fantastic, that's really helpful. Well, someone's actually just made a comment, really, isn't it about time vaginal estrogen was available off prescription if doctors are reluctant to prescribe it? And it's just that over the counter, making it easy type thing.
I know, it would be good. It really would be helpful. And I think also, you know, it comes back to I am a GP as well. And so, you know, GP is a tough gig, but every woman will go through the menopause. So, working hard with GP education as well. So there is no reason why GPs shouldn't be prescribing if there aren't absolute contraindications.
Fantastic. Thank you.
It's easy to say persevere, isn't it? Particularly when it's hard to get to your GP. But I really would ask you to challenge why your GP is saying you can't have a vaginal estrogen. I really would.
That's really helpful. And someone's put, is it ever too late to start? I'm in my early 50s.
No, early 50s is young. I think that is not too late to start. Go for it.
Yeah, absolutely. And then I've got somebody asking around, the issue they have is around that kind of urge incontinence where they suddenly need to go and they can't stop themselves, and that fear when you're out and the anxiety that comes around that. Just what advice would you give to somebody in terms of the steps they might take to try and take control of that?
Yeah, I'm really glad that you brought that up, because one of the other consequences of the menopause and losing estrogen on the bladder specifically is the bladder, which is a bit of a delicate muscle. It's a delicate flower, is our bladder. It can be sensitive. And when you lose estrogen, your bladder is more prone to squeeze before it needs to. And so using a vaginal estrogen or HRT can help that, if that's the reason. So when your bladder starts to squeeze, what that translates into, that urge that when you go, you've really got to go, and you know where all the loos are on all your routes. And so there is evidence that a vaginal estrogen can help that. There is other medication that can help, available through your GP. Caffeine makes that particular issue worse. Alcohol makes it worse. So avoiding both, particularly caffeine in the day, can be terrible for just making your bladder even more contracty. Yeah. There is physiotherapy that can help with that as well, where you sort of train your bladder to hang on for another 30 seconds if you can, to sort of get your bladder used to holding a little more urine instead of just contracting prematurely.
Yeah, and I think that kind of goes into the idea of the kind of what I always refer to as the just in case just before you're going out, even though you don't really need it, you go. Is that a thing we should be trying to avoid doing? Is it a good thing to do? Kind of just are we if somebody's going too often, is that an issue for people?
Yeah, so we call it the prophylactic in our house too. So no, so it's fine. But it's like anything, in moderation. Going to the loo every half an hour just in case is not good, because your bladder it is a muscle and it does have to stretch. And if you are going to the loo a lot in advance, then the bladder just doesn't get used to being stretched. I would say that going for the loo just in case before you go out, as long as you're not doing it like every couple of hours, 3 times a day, is probably okay.
Yeah. Okay, that's great. We've got quite a few comments, people saying that they know that feeling, definitely. Yeah. And the final question I had was just around exercise. So we've got a couple of things. Somebody saying can actually going on the trampoline, so they use a rebounder, so a small trampoline, could that cause prolapse issues? And also whether somebody should just keep going, running or whatever if they're having leakage, or should they try and tackle that and not just kind of accept it? Just a bit of a guidance really around exercise and what we should and shouldn't be doing.
Yeah, no, it's a really good point, because once you feel that your life starts contracting with your symptoms, it can be so depressing, can't it? So I'm not a physio, but what I would say is, if you need to run, I need to run, and I've got a dicey pelvic floor, but combine it with physiotherapy, maybe combine it with doing your pelvic floor exercises. Get a really good pair of trainers that try and reduce some of the impact. If you need to run, you need to run, but it's like everything in sort of moderation. Trampolining is not great but in just that it's just, you can imagine my hand is a womb up and down on the muscle, but if you really love trampolining, don't stop. Just make sure that you're doing your pelvic floor exercises and you're minimizing your other risk factors as well. So if it's really bad and you're running a lot and your pelvic floor is just getting worse and worse, if the stress incontinence is getting worse and worse, then it may be that you just need to run shorter distances, take a break, get some physio. It's tricky, isn't it? It will be different for every woman. There's no right answer, I think.
Absolutely.
As one who has run through all sorts of things.
Yeah.
One quick final one, is weight training safe? That's come through a few times as people have heard you talking about running, whether weight training is okay.
Yeah, again, it depends what you do. If you're doing, so weight training absolutely can be fine, but it's just making sure that you're bracing your core, that you're bracing your pelvic floor almost, as you're doing it. So it's just being really mindful of what you need to do to keep that pelvic floor strong, as well as exercising your other muscles.
Wonderful. Thank you very much. And as always, Sally Leach, thank you very much for looking after the questions, and so many comments in chat. We'll share them with you afterwards, Dr. Clare. One of them says, I wish all GPs was like Dr. Clare.
Oh, that's fine. Thank you.
So thank you very much to everyone who's joined us today. And thank you, Clare, for your expert top tips. I think we're all, and maybe I've got this right, training our pelvic floor like we're running a marathon, talking to our GP about local estrogen as and when required. We will share the Squeezy app and some of those helpful resources. We'll see if we can see any of those gadgets or whatever, for those of you that want to do your kegels while you're walking around the shops. I think I saw one of them advertised as, but appreciate that is not a recommendation or any marketing at all. Do your own research. This is all about informed choice. But we've heard so much valuable information today, and thank you very much, Dr. Clare. I do hope you join us again. We hope everybody else enjoyed that session too, and do keep the questions coming. We will be sending out the notes to this session and, of course, sending the recording on too. Thank you very much.
Thank you.